It's official. Medicare costs will eat up much of older Americans' Social Security cost of living increase next year. The standard monthly premium for Medicare Part B, which covers outpatient care, doctor's services, durable medical equipment, and preventive service, will be $202.90 in 2026, the Centers for Medicare and Medicaid Services said on November 14. That's up $17.90, or nearly 9.7% from $185 in 2025. It's smaller than the $21.50 increase the Medicare trustees had forecast earlier, but still the second largest dollar jump in program history behind 2022's $21.60 gain and almost 3.5 times the 2.8% Social Security raise for next year. That means seniors will probably see a drop again in their standard of living, experts said. Seniors were the only ones who saw an increase in poverty in 2024. All other age groups saw a decrease or stayed the same. The public is likely to perceive this Part B increase as taking a significant chunk of or even most of their COLA, said Mary Johnson, independent Social Security and Medicare policy analyst. In other words, another continuation in relentless cost increases battering consumer finances. Monthly Social Security checks will rise $56 on average starting in January because of the 2.8% COLA, the Social Security Administration said. After the $17.90 increase in Medicare Part B, the average monthly COLA, cost of living adjustment, increase is cut to $38.10. Hold harmless provision. Such a large increase in Medicare Part B will likely trigger the hold harmless provision for Social Security recipients with a Social Security benefit of $640 or less, Johnson said. The Medicare hold harmless provision prevents the Part B premium increase from being larger than the Social Security COLA. If a premium increase is higher than the COLA, the rule prevents the beneficiary from paying the full increase. The portion of the increase those beneficiaries don't pay is spread out among others who aren't protected by the rule. For those people with a Social Security benefit of $640 or less, the 2.8% COLA next year would mean less than an $18 per month increase in their Social Security checks. Without the hold harmless rule, the Part B premium increase would swallow the entire COLA. In 2022, only about 1.5% of Medicare beneficiaries had their Part B premiums limited by the hold harmless provision. Government data showed Part B rose $21.60 to $170.10 in 2022, while the average monthly COLA increase boosted Social Security checks by $92. In 2017, when Medicare premiums jumped 10% or $12.20 to $134 and far outpaced the 0.3% or $5 average monthly COLA increase, 70% of Medicare Part B enrollees paid a lower than standard Part B premium due to the hold harmless provision. Hold harmless rule isn't panacea for all costs. The hold harmless provision can protect seniors from Part B premium surges, but other costs may bite, Johnson said. If individuals have other automatic deductions such as for Medicare Advantage or Part D premiums, increases in those premiums could reduce Social Security benefits, Johnson said. The optional Part D covers prescription drugs. Some Part D plans are increasing premiums by as much as $50 in 2026, the maximum allowed under a Part D premium stabilization demonstration program, according to the nonprofit nonpartisan research organization KFF. To complicate things, there are fewer standalone Part D plans to choose from, Johnson said. The total number of prescription drug plans has dropped by half since 2024, KFF said. Is everyone eligible for hold harmless? Those who aren't eligible for the hold harmless provision include new Medicare enrollees, people who aren't receiving Social Security benefits, high-income earners. What about deductibles? In addition to higher premiums, higher annual deductibles next year will make health insurance even more expensive for Medicare enrollees. The annual deductible for all Medicare Part B beneficiaries before insurance covers costs will be $283 in 2026, up $26 from $257 in 2025, CMS said. Could it have been worse? The Part B premium could have been higher, CMS said. If the Trump administration had not taken action to address unprecedented spending on skin substitutes, the Part B premium increase would have been about $11 more a month, CMS said. However, due to changes finalized in the 2026 physician fee schedule final rule, spending on skin substitutes is expected to drop by 90% without affecting patient care. Skin substitutes are materials like biologic, synthetic, or biosynthetic products that mimic human skin and are used to cover and treat chronic wounds, such as diabetic foot ulcers. The Trump administration reclassified these bandages so they aren't billed separately. CMS estimates the change would reduce Medicare spending on these products by nearly 90% in calendar year 2026. Medicare trustees also estimated earlier this year that the standard monthly Part B premium would rise $21.50 to $206.50 in 2026 from $185 in 2025. That would have been more than the $17.90 increase to $202.90 in 2026. Just an overview of some Medicare changes. If you are on Medicare, it's best to call CMS and/or contact an agent to help you navigate the program and learn about all your options. Hope you enjoyed the information. Feel free to like, share, and subscribe for more updates.